everyone. Good afternoon. Thank you for being here. My name is Kimberly Lang. I just want to welcome you all to the first FNHDA webinar of 2026. Weird that is to say that we're here already. I'm here on the unceded territory of the Squamish Nation at our offices at Park Royal, along with my coworker Shay. And yeah, just lovely to see you all. I think we'll probably have a few more people join us as we go, so we'll just keep an eye on the doorbell and keep letting people in. And in the meantime, I will turn it over to our wonderful presenters, starting with you, Shay.
Thank you, Kimberly. Hi, everybody. My name is Shay Whale. I am the Respecting Tobacco Consultant at the First Nations Health Authority. Today I'm calling in from Lheidli T'enneh territory up in Prince George, but usually I live on Westanek territory. But glad to be up here. It's super warm, way warmer than I thought it would be. It's like plus 6 or something like that, which is crazy. So myself and my colleague Jax are here today. I didn't know we were the first presentation of the year, so that's kind of exciting. We are here to talk about tobacco cessation supports for First Nations people in BC so that hopefully your community members can access them, or you can pass this information off to your health staff. And they have a little bit more knowledge about what kinds of services and supports exist for somebody who would like to quit smoking. We kind of thought this was timely because National Non-Smoking Week is next week. So from the 19th to the 23rd, or I think it's supposed to be the whole week, actually, but we're doing 5 days of promotional posts and a contest at the First Nations Health Authority. So keep an eye on our social media to have a chance to enter in a contest if you quit smoking for the first or for the week of National Non-Smoking Week, or if you just want to share a milestone, whether you've quit or not. That's my little promo. And I will pass it over to my colleague Jax now.
Thanks, Shay. Hi, everyone. Um, I just want to thank everyone so much for inviting me to present today. As Shay mentioned, my name is Jacqueline. Well, I go by Jax. My name is Jacqueline, but I go by Jax. And I am very privileged to present to you today from the Sunshine Coast on the traditional and unceded territory of the Sechelt Nation. It's also very warm here. It's like 13 degrees or something. It's crazy. So yeah, a little bit about me. I'm a senior specialist with the Canadian Cancer Society, providing outreach and education on our Indigenous commercial tobacco reduction and cessation program called Talk Tobacco. After my presentation, Shay will be presenting about First Nations Health Authority supports for tobacco. So Shay, you can go on to the next slide. Perfect, thank you. So this is what we'll be discussing today regarding Talk Tobacco. Please note you're welcome to take notes. I talk a little bit fast, but I'll also provide this presentation with notes later in the week for Kimberly to send out to everyone attending. So today we'll be going over traditional versus commercial tobacco, smoking rates in Indigenous communities. Talk Tobacco, I'll give a brief introduction, then I'll move into our story and what makes us different. I'll provide a quick overview of how our Quit coaches work and what makes them different. I'll discuss how people can be referred to Talk Tobacco. I'll give an overview of what callers can expect when they call in, and I'll finish up with information about promotional materials and outreach activities. Next slide. Perfect, thank you. So something I like to make very clear when I talk about Talk Tobacco is that we are very cognizant and respectful of the difference between traditional and commercial tobacco. It's very important to us to ensure that we honor this distinction and ensure people know when we talk about tobacco reduction and cessation, we are speaking only of commercial tobacco. Traditional tobacco is medicine used by some First Nations and Métis people across Turtle Island. Its use is guided by cultural protocols and teachings that vary between nations and communities. Understanding the nuances between traditional and commercial tobacco is of paramount importance to us. Traditional tobacco is more than a commodity or health concern. It is intertwined with cultural rituals, practices, traditions. It's often used in ceremonies, rites, and offerings, symbolizing respect, prayer, and connection to land and spirit. The narrative of traditional tobacco is not singular but diverse. Commercial tobacco, on the other hand, refers to tobacco products that are manufactured, marketed, and sold by the tobacco industry for profit. These products are designed for recreational and addictive use, not for ceremonial or medicinal purposes. My team lead, Dina from the Cancer Society, who is Métis, described this dichotomy through story, and I'm just going to use her words to explain it. So she says, traditional tobacco is part of creation stories, ceremonies, and practices. It represents respect, prayer, and connection to the creator and the land. Using tobacco in this way is about relationship and reciprocity, not addiction. Commercial tobacco use often reflects colonial disruption, trauma, and targeted marketing. For many, smoking is tied to stress, coping, and social norms, a story of survival in the face of systemic disadvantage. These stories matter because they explain why quitting is complex and why culturally safe approaches are essential. Next slide, please. So this graph shows results from the Canadian Community Health Survey conducted between 2015 to 2018 using the Health Inequalities Data Tool. It provides a look into the rates of smoking in BC amongst Indigenous peoples versus non-Indigenous. As you can see from this chart, Indigenous peoples in BC, and for the purposes of this survey, this refers specifically to First Nations, Off-Reserve, and Métis, are more than twice as likely to smoke as non-Indigenous. Newer data from Stats Canada from 2022 shows a 20% smoking rate among Métis in BC and a 24% rate amongst First Nations. This compares to a rate of approximately 8.5% amongst non-Indigenous peoples. This data is limited and doesn't include vaping, but it provides a view into the increased use of commercial tobacco products amongst Indigenous peoples in BC. And though it isn't specific to BC, another relevant statistic from the Canadian Student Tobacco, Alcohol, and Drugs Survey in 2015 found that Indigenous youth in Canada were more than 5 times more likely to smoke than non-Indigenous youth. That's obviously a huge number, though it is to be taken with the caveat that the data is more than 10 years old, and the main modality for nicotine use now amongst youth is generally vaping. But it still provides some context. Amongst youth in BC, specifically as of 2022, the Canadian Tobacco and Nicotine Survey shows 29% of First Nations youth had ever smoked tobacco, compared with 14% of non-First Nations youth. However, what is also interesting to note is that Indigenous youth were also more likely than non-Indigenous youth to attempt to quit smoking. So this is very important to our program and Talk Tobacco. Next slide. So who are we? What is Talk Tobacco? It is a free, confidential service. It's operated by the Canadian Cancer Society, offering culturally relevant and accessible support and information about quitting smoking and vaping, as well as other nicotine device or delivery systems in general. We also support cessation of other smoked products, such as cannabis and other commercial tobacco product use. We offer these services to Indigenous communities by phone, text, and online for First Nations, Inuit, Métis, and urban Indigenous communities. We offer services from a trained quit coach in which people can engage by phone call, text, or chat messaging to gain support for quitting. Next slide.
I might actually just run and grab my kid on the way home
So how did Talk Tobacco come to be? For context, the Canadian Cancer Society has run the smokers helpline across Canada for over 2 decades, not in BC as we have the BC Lung Quit Now line, but neither one of these lines specifically are tailored to suit the needs of Indigenous peoples, the Quit line nor the smokers helpline, which is why Talk Tobacco was originally created. So Talk Tobacco began as a partnership between the Canadian Cancer Society and Ontario Health's Indigenous Cancer Care Unit, the ICCU. In 2017, a group led by the ICCU called the Joint Ontario Indigenous Cancer Committee indicated the need for tailored and culturally appropriate cessation services and recommended that the Canadian Cancer Society lead the development of a program to meet this need. In 2018, we conducted a survey of Indigenous healthcare providers and smokers to determine the feasibility of services. We also completed a literature review of Indigenous-specific tobacco cessation quitline services. Through 2018 and 2019, funding was secured through the Canadian Partnership Against Cancer to create culturally appropriate cessation services for First Nations, Inuit, and Métis peoples. And in 2019, engagement moved on from Ontario to Saskatchewan. and the program was extended. In 2020, the phone service Talk Tobacco was launched in Ontario and Saskatchewan. In 2020, we also launched our Facebook page and began our engagement process for Manitoba. In 2021, website, text, and live chat services were launched, and an Inuit scan was completed. In 2022, an evaluation report was completed and presented to CPAC. And finally, and most importantly to my work, and the reason that you're all here, is Talk Tobacco launched in 2022 through 2023 in partnership with FNHA in British Columbia. And the photo you can see on the background of this slide is from one of our engagement sessions in Saskatoon in 2019. Next slide, please. From our consultations and our engagement, here is what we heard in the development of Talk Tobacco. So we heard that our Quick Coach should be well-versed in Indigenous cultures and history, that mental health and addiction play a significant role and must be considered in provision of services. Resiliency and trauma training is essential for Quick Coaches. Indigenous people are a diverse population in Canada, and homogenous assumptions should not be used. We heard that lived experiences of Indigenous community members vary with different levels of knowledge and connection to traditional ways of being. Therefore, a tailored and individual approach would be important for each client. We also heard that a relationship-based approach with one Quick Coach is preferred, and it may require several calls with clients and perhaps their family to build trust and hear their story. That buy-in and support from Indigenous health and leadership organizations will be essential. Buy-in and trust from Indigenous communities and individuals will take time and must be considered when setting evaluation goals. Services must be free, they must be judgmental, and they must be easily accessible. And that youth vaping was seen as a significant issue even as of the 2018-2019 engagement process. Next slide, please. So these are a couple of quotes from our early consultations. The top one is my favorite because I think it's the most Canadian thing ever. I don't want to start over. It reminds me of calling Rogers and being rerouted. So that was one of our participants in July of 2019 in Ottawa. And another one said, no, press 1 for this and press 2 for that because people will hang up. And that was from a participant in Garden River on September 19th of 2019. So in other words, they don't want to be routed to a service that feels like they have long menus that they have to deal with, that feel like you're not talking to a human and where you're not talking to the same person every time. Next slide, please. So we are a service that is rooted in respect. We took the input from the consultations and we made sure to integrate what we heard into the design of Talk Tobacco. We established the following best practices. Our program is culturally safe and respectful. Our programs are developed by, with, and for Indigenous communities. We are trauma informed. Our Quick Coaches are educated on colonial impacts and historical and current challenges of Indigenous peoples. We need to ensure that services are free, confidential, and judgmental, and they are. We use a pan-Canadian guidelines for smoking cessation, but it's been adapted for Indigenous context specifically. Talk Tobacco is accessible and flexible. It's offered by a phone, chat, and text. We provide support in Indigenous languages. We currently offer our services in 24 Indigenous languages through an interpretation service. I'll have a little bit more on that in a moment. And what you can see on the screen here is a quote here from Mark, one of our earlier clients, and he says, their support was marvelous, and with their help, I've been smoke-free since January of 2020. It's given me more hope. I can now take a breath of fresh air or a bite of food and truly appreciate it. Next slide, please. What are the key features of Talk Tobacco? Our Quick Coaches empower Indigenous callers on their journey to quitting by bridging cultural understanding with evidence-based practices. They have a knowledge of distinct and diverse Indigenous cultures. We don't use a pan-Indigenous approach. We recognize the differences between Indigenous cultures in Canada and the unique needs created by these differences. An applied relationship-based approach with one Quick Coach. So our callers will always have the same Quick Coach, so they don't have to keep telling their story. We know smoking can carry a lot of trauma, and having to start over on every call makes the journey that much harder. We allow for as many calls as the client requires. We don't limit their time or number of calls with our coaches. We employ a cultural competency lens, and we have ongoing training, assessment, and training for our quick coaches. Our coaches and health promoters, such as myself, have a knowledge of colonial impacts and historical and current challenges of Indigenous peoples. Our coaches can also help with navigating non-insured health benefits for First Nations and Inuit callers. We can help with NRT options and smoking cessation medications like Zyban and Champix and help them navigate what's available here in BC. So next slide, please. After seeing the presentation to this point, you might be asking, what are quick coaches? So our quick coaches are trained cessation specialists in behavior change, motivational interviewing, trauma-informed care, and nicotine addiction. They help clients to build personalized quit plans with each client. They offer ongoing support via phone, text, and online via live chat. Now, what I will say about our chat line and our texting, it is still our quick coaches. So they will be behind their computer typing the responses. We just realized that different people prefer different modalities for accessing our services. So we like to be flexible, but it's not going to be an AI. It's not going to be a computer. It's going to be someone in Canada, one of our trained quick coaches behind their computer that will be texting back. Our quick coaches can provide guidance on nicotine replacement therapy, as I mentioned before, and also other drugs that can help with cessation. Our coaches ensure culturally appropriate services are made available to clients. And most importantly, I think our services and our quick coaches can help bridge gaps between clinical visits. So we can be used as an adjunct service to other smoking cessation services, such as the Quit Line from BC Lung, the PharmaCare 12 weeks of NRT and or prescription support for Zyban and Champix that is offered. In addition, the NIHB benefits offered to Indigenous and non-Indigenous smokers and vapors in BC. We provide a support for these existing programs and can be used in conjunction with them, as well as visits with doctors, nurse practitioners, respiratory therapists, support groups, whatever it is that people are choosing to use on their journey. We can just be a support for that. We do not have to be the only thing that people are accessing. Next slide. Our quick coaches use the following guiding principles for counseling. So we use motivational interviewing, cognitive-based therapy, client-centered philosophy. We offer culturally sensitive care. We have meaningful participation and engagement, and we do all of our work through an equity lens. Our work is evidence-informed. We have continuous quality improvement and evaluation to ensure that we are up to date and providing the best care. Next slide, please. We are always learning. Here are some of the lessons we've taken from our work so far. Our callers prefer one-to-one case management styles. So as I mentioned, callers will always have the same quick coach. They will not be shuffled between different coaches. Callers who are interested in nicotine replacement therapy often have non-insured health benefits coverage, but they're not familiar with the duration or how to access it. And so we can help them learn how to access quit aids with a status card. Some talk tobacco callers were hard to reach, while others want frequent calls, so like more than once a week. As a result, we don't place limits on the call schedule, so long as it fits within our hours of operation. It may require more than 4 missed attempts or calls at specific scheduled times to meet client needs, and that's okay. We can be flexible. Connecting with talk tobacco callers varied by individual preference and availability. So the way that we connect with them changes depending on what their needs are. And importantly, slips and relapses are common, often in the very early stages of the smoking cessation journey. And our quick coaches know this, and they can work with people so that there's no stigma attached to that. Next slide, please. So as I mentioned before, we offer our services in many Indigenous languages. We use a translation service called CanTalk to do so. So we have the list up here. You don't have to write this down or anything. I can send this list out when I send out the slides. But it just gives you an idea of the services that we can offer and the language translation services that we can offer. Next slide, please. This is a brief summary of the services we offer. We offer phone services Monday through Thursday from 5 a.m. to 6 p.m., Friday from 5 a.m. to 3 p.m., and Saturday and Sunday from 6 a.m. to 2 p.m. Pacific time. Our live chat and text support follow the same hours as it is our quick coaches, as I mentioned, who are texting on both the chat and the text. We also have our quit map, which is on the website and shows local programs and services to help quit or reduce smoking and vaping. And we also have our quick calculator, which can help calculate how much extra money you can save by quitting, which is a pretty big motivator for a lot of people. Next slide, please. People interested in using Talk Tobacco can self-refer on the website, of course, or by phone or by texting change to 123456, or they can be referred by healthcare providers or allied health professionals. We can send physical copies of the referral forms to any interested parties after this webinar. You can reach out and I'm happy to send out the referral form, the physical form. It's also available on our website. The referral process by healthcare providers is very important. So I want to make sure I really emphasize this. 60% of those contacted by a quick coach would not have called had they not, that 60% of those who engaged with a quick coach would not have called or not engaged with us had they not been directly referred for proactive service. So what this means is a lot of people aren't going to continue with it or make the initial call and contact if they aren't referred by a healthcare provider or an allied health professional. So any healthcare provider or allied health professional can refer their clients. The referral form is completed and sent to Talk Tobacco. It is received through a secure online program if it's done online. We can also retrieve it by fax or email. Referrals are pulled daily, so we do it on an ongoing basis, and they're inputted into a secure, confidential database called Smokescreens. That's our software that we use. Calls are scheduled according to the information provided on the referral form, so people can write their preference, morning, afternoon, evening, or anytime call. Calls are assigned to a tobacco cessation specialist known as our quick coaches. We aim to place a first call to a client within 3 business days of receiving the referral. So we're quite prompt on getting back to people because we know that there's that sweet spot where they've done the outreach and they've done the work to initiate contact, and we want to make sure that we honor that. We follow up after receiving the paperwork. So if a client has given permission, we leave a voicemail message with each call attempt. Up to 5 to 6 attempts are made for Talk Tobacco clients. And for follow-up calls, once we've already engaged with them, 3 call attempts are made. To summarize, within 3 days, your client or patient will receive a phone call from a quick coach at Talk Tobacco if you sign them up for this service. Next slide, please. This is just a screenshot of our website landing page. It's just talktobacco.ca. It's available in English and French. It provides program information, an overview of our services, self-guided cessation and planning tools, frequently asked questions, incentive offers, healthcare provider resources. And you can also see on the slide that there's a chat on the side, on the right side there, that enables visitors to engage directly with the Cancer Society, to be connected with a quick coach, or to ask any questions that they may have. So we try to make it as easy as possible for people to access our services. Next slide. So what does our first phone call look like? We start with an overview to serve as an introduction. So after the overview, where we introduce ourselves, our quick coaches do a quick introduction, we ask the client's permission to ask some questions. So we do our basic assessment to learn more about their commercial tobacco, nicotine, vaping, e-cigarette, or smoked cannabis use, and help them create a personalized plan. We assess them for level of dependence. So how many cigarettes per day, how soon after waking are they smoking? We assess them for their stage of change. So are they planning to quit within the next 30 days, or is it more like in the next 6 months? This time of year, is it a New Year's resolution? Have they set a quit date? Do they use other commercial tobacco products like cigars or cigarillos, pipes, or chewing tobacco? New modalities are tobacco pouches, for example, the nicotine shredded pouches like Zyn and Zonic. Are they vaping? So are they intaking nicotine in other ways? And are they also smoking cannabis? And generally, the assessment is tailored to the client and broken down into several parts. And it changes a bit, but it may consist of readiness to quit, so their readiness to change, their commercial tobacco use, history of previous quit attempts, self-efficacy factors, social support, other commercial tobacco users in the caller's environment, physical and or mental health challenges relevant to quitting. We then book a follow-up call, so we will attempt approximately 3 times to reach the client for the follow-up. Smokescreens, which is our software, uses an algorithm based on the client's stage of change, which determines how soon a follow-up call should be. However, our quick coaches can also manually schedule a follow-up call based on client preferences, so we're very flexible on this. A typical client, and I say typical because we are so flexible, a typical client would be offered approximately 10 follow-up calls over the course of 3 months. We also do a final follow-up at 6 months from initial contact. Clients who are pregnant or postpartum, as well as clients with mental health conditions, can receive additional follow-up calls. And again, pretty much anyone can access as their needs are. We meet them where they're at. So if somebody needs more help than 6 months, that's fine, or 3 months. If someone needs more calls than approximately 10 calls over 3 months, that's okay too. We're very flexible to meet client needs. There's no set limits to call number. There's no set limits to the duration of the calls or how long they can access the service for. And also note, we are able to help clients of all ages. So we offer smoking and vaping cessation support for youth as well. However, those under the age of majority, so here in BC, that would be 19, cannot participate in our contests. And I'll go into a little bit more information about our contests in a moment. Next slide, please. So Shay will be discussing the cessation supports offered through NIHB in a little bit more detail later, so I'll leave that information to her. But I do want to point out that our first week challenge contest, which is on this slide. So if clients call our quick coaches and register, over 19 years old only, unfortunately. And if they call for the first week of the month, they can be entered into our first week challenge contest. It's $500 prize. It resets every month. And due to the generosity of our partner, FNHDA, we have our own pool for BC. So as of right now, if people enter, they have a very high chance of winning. So if they call our service, they quit smoking for a week out of the month, and they sign up, it can be as high as 1 in 2 or 1 in 3. So, it's definitely a good motivator for potential clients. If you have anyone that you think might be interested, this is a good way to get them to make that initial call and make that initial contact. We also have a trial coupon offer from our sponsor, Kenview. They're the makers of Nicorette and Nicoderm. So if people purchase 2 products, they can get $20 off on those products. Next slide, please. I have promotional materials, I have physical handouts and information I can send out. I have postcards with information about the physiological benefits of quitting. Unfortunately, I don't have a copy of that up here, but it's just like a little chart that kind of shows at different stages, like at 20 minutes, in 1 day and, 6 months and the physiological changes that will happen when you stop smoking. And both of our postcards also have information about what makes talk tobacco different from other quit lines. I also have the white poster on the left side of the screen, which is letter sized and can also be sent out. As I mentioned before, I also have the referral forms, and they just come on pads, so I can tear off some pads or send an entire pad if you'd like hard copies of those. I also have magnets, which look like the image on the right, and I have some packs of sugar-free gum that are branded with our Talk Tobacco information as well. So after, today, after the webinar, feel free to get in touch with me, and I am happy to send out as much hard copy promotional material as you would like. Next slide, please. So in addition to sending out promotional materials, I am available to present to any interested parties, both in person and virtually. I live close to the Lower Mainland. As I mentioned, I live in Sechelt on the Sunshine Coast. So in-person presentations for those areas are really easy to accommodate. I will be traveling throughout BC in the spring, summer, and fall, so I can also schedule in-person meetings or presentations before traveling to those localities. So just reach out if you want me to come in person and give a talk or meet with you or meet with people. I'm happy to do so. Next slide, please. You don't have to write this down. I know there's a lot on this page. I will send all of this information out. But it's just our contact information. We are on all major social media platforms. We also have a newsletter you can sign up for to keep you updated. This slide, like I say, it's got a lot of information, so and it's kind of small and a bit hard to read, so don't worry about reading it, but I'll send it out for Kimberly to forward on. And if you require any additional information on Talk Tobacco, please don't hesitate to contact us by phone or email. You can email us at talktobacco@cancer.ca, or you can email or call me directly. My information's on the next slide, and I will also send that out after the webinar. Next slide, please. And that's it for me. Thank you so much for having me. I'll pass it over to Shay, who did an amazing job with advancing the slides. I am Zoom not literate, so I really appreciate her taking that on. And she'll be presenting a little bit more in depth on First Nations Health Authority supports for tobacco.
Sorry, I was struggling to find the bar to unmute myself, so maybe I'm not so Zoom literate either. I'm here to just add a little bit of information to Jax's fabulous presentation. Talk Tobacco is one of the supports that FNHA has partnered with Canadian Cancer to offer Indigenous people in BC. But there are other supports that FNHA can offer for communities as well. So I'm just going to go through a few of those. There we go. So one of the biggest things that we do, myself and my colleagues in the tobacco kind of role, is community presentations. We are able to go to communities and just give presentations tailored to kind of like what the community would like to talk about. Often this is like school presentations for youth and for children. This could be also presentations at the youth treatment centers or adult treatment centers. We've done that before. We've done attendance at community health fairs, like having a booth and stuff like that. If anybody wants to just have us come pass out resources and talk to people. We're extremely flexible and we are able to travel to come to you if that's what needed, or online if that works better. We also have free resources that we can mail to communities. On the Respecting Tobacco webpage, which we will send out after this, there's quite a list of resources that you can offer in community that have information about kind of like, well, we have some on traditional tobacco, but we have some as well on commercial tobacco, cessation supports, like what to do if you're thinking about quitting, Mythbusters type stuff. I have another slide on it, so I'm not going to spoil the slide. And then lastly, we can also support access to nicotine replacement therapy. So I think I have another slide on this. This is just I guess, the title slide. So resources for communities. These can be ordered and mailed to you by emailing me at respectingtobacco@fnha.ca. That's my email, so if you email it, you'll get me. We have a wide variety and you can kind of browse them on our webpage, but we've got youth-specific resources. We've got resources that outline the coverage for nicotine replacement therapy products or medications. We've got tips for quitting. We've got Mythbusters. We've kind of got like an overview of how quitting smoking can change your health. There's lots of information and we can send it all to your communities for free if you want to have it in your health center or if you want to have it for an event. Totally doable. Just send me an email and I will arrange that for you. One of the other big things that we do is we help people navigate the coverage for nicotine replacement therapy. So in BC, under it's called Plan S, but BC offers 12 weeks of coverage for things like the patch or the gum or lozenges, sprays, and then some medications like varenicline for quitting. 12 weeks is not necessarily a super long time, and often people can try more than once in a year to quit smoking if they're not successful on the first attempt, which is super normal. They will use up that coverage because you can only access it once per year. So the First Nations Health Authority, through the Non-Insured Health Benefits Program, can provide an additional 24 weeks of coverage for those medications. So in total, a person can access up to 40 weeks, and we can kind of help them figure out that process of how to talk to a pharmacist, what to ask for, that kind of thing. The coverage can just be accessed by speaking to a pharmacist, so anyone can go up to a pharmacist and ask for it. But sometimes people need a little bit of extra help in understanding how this might interact with the non-insured health benefits or Plan W, so we can help that. Oh, there's my community presentation slide. So we do community presentation slide. The main kind of information on this slide is we have staff in the regions who can help with that. Arsh is our fabulous presenter in the north, and Megan is our fabulous presenter in the Fraser Salish. And I work to support the staff in the Vancouver Island, the Vancouver coastal regions, and the interior to kind of make sure that they have enough knowledge about commercial tobacco when they are doing their presentations as well. So that's kind of short and sweet for me, but that's it for today. If anybody has any questions, please let us know. We're happy to answer them, and we will send out the slide deck and our emails and resources so that if you don't have any questions now, but you think of something later, you can email us.
Thanks, Shay and Jax.
Thank you. Thank you for having us.
Yeah. I don't know if anyone has any questions. I don't see any hands up. And the only comment in the chat is Jessica has a health fair coming up on Monday. Wink, wink, nudge, nudge.
Send me an email, Jessica, and I will see what is possible.
Does anyone else have any comments or questions? Go ahead, Pamela.
Yes, thank you. Beautiful presentation. I'm just wondering because a lot of people don't like the Nicorette gum that they prescribe. It's usually the mint or whatever. They're really stuck on just the mint at pharmacies. Will they prescribe different flavors if we go through FNHA?
I'm not sure about the answer to that question, actually. I think that the flavors available are kind of something that's regulated by Canada. So I'm not sure what else is available that would be considered able to be prescribed. If you'd like, I can write down your question and I can get back to you
Right.
with it, though,
Because
if you send me an email.
yeah, some people like the cinnamon flavor, but when
Yeah.
they were prescribed, we get a prescription, then, the pharmacist says, nope, this is it. They only do the mint.
Yeah,
And
okay. I can definitely look into that further.
thank you so much.
Thank you for your question.
There's a question, Shay from Quatsino, wanting to know if you have dates of when you're coming to the island or if you can share those dates out.
So I actually live on Vancouver Island, and I know that we are hiring another staff member on Vancouver Island who will also be able to come and present. So it's really more about what dates work for community. And for Jacqueline, I'm not sure if you've planned any travel to the island yet, but I think you're pretty flexible at this point.
Yeah, thanks. I'm very flexible. I haven't planned yet. I'm aiming to do Lower Island, not North Island, sometime probably in February, or possibly March, just because Lower Island I can access, without the weather being as much of an issue. So yeah, if anybody's interested in having me come out, I also am free Monday and I'm going to be on the Lower Mainland. I don't know if Jessica's interested in having us come out and sit at a table, but I'm happy to attend the health fair. But yeah, just reach out to me and stay in touch. And when I'm on the island, I'm happy to come around and meet up.
Awesome. Yeah, and I see there are the Jax has put her contact information in the chat, and then also the respecting tobacco at fnha.ca email is in there as well. And just before we get to you, Pamela, I see you have that again. there is just a comment from someone who mentioned that they're just sort of the dangers of like overdoing it with the Nicorette, and that too much nicotine is a bad thing no matter how you ingest it. So I don't know if do you have any materials on sort of safely using the cessation products so you don't overdose yourself on nicotine?
Actually don't have a resource like that, but I can definitely make a resource like that if that is something that would be needed. And I do agree because we talk a lot about, I haven't seen it. This is my first time kind of hearing about it related to Nicorette gum, but we often hear about it with when somebody in the house is using a refillable vape. If you get the liquid on your hands, it can do the same thing. So it's like acute nicotine poisoning, essentially. It'll make whoever touches the product sick. So we've heard about it for kids or pets who get into it, essentially. So there are definitely dangers associated with it, and it's important for people to be aware of that.
Great, thanks.
I see a lot of questions. Will we have somebody coming to the Okanagan? That far in advance, if you send me an email, we can ensure that somebody can come to the Okanagan. So the further out, the better in terms of staffing. I see some very soon health fairs, which I can definitely see if anybody is available, but I'm not sure about that quick of a turnaround. We will see. Curious if these coaching techniques are transferable to other addictions. So the quit line itself is kind of specific to commercial tobacco and cannabis cessation, but the techniques that the quit line uses, like for example, cognitive behavioral therapy or motivational interviewing, are common among other addictions coaching as well. So some of the techniques are definitely transferable to other things, but the quit line itself is designed to be specific to commercial tobacco and cannabis.
Yeah, and I'll just add to that. We cover cannabis, but only if it's being smoked. So we don't cover edibles or any medicinal cannabis or anything like that. It's more just around basically what we cover is any nicotine delivery. So even if somebody's using pouches, or they're using chewing tobacco, or they're smoking vapes, or they're vaping, I should say. We can cover that. And then also if they're smoking other substances, if they're using hookahs, like we can cover all of that. But yeah, we don't cover any other substance use other than cannabis, and only if it's being smoked.
Thank you for that question. I see comments too. We hand out the gum as well, and a lot of people think we're handing out Nicorette gum, but we're like, no, no, it's just sugar-free
Yeah.
gum. You can just have it.
Yeah. I get that a lot too. People are like, "Are you giving out Nicorette gum at a health fair?" And I'm like, "I'm not.
Yeah.
It's just Dentine."
We give it out at the youth forum because it's very popular. And again, people are like, why are you giving this away? We're like, no, no, it's just mint gum. It's fine.
Is it Charlene? cweb@kidsandcallum.com. I think it's Charlene. I've been in touch with Lynette just recently, and I sent out some materials to her. I'm going to be in the north for the rural health conference at the end of May, and so she and I have been connecting on that as well. So I can email you, or I don't know if your email is for Shay or not, but yeah, just let me know if you want me to get in touch, or if you want me to go through Lynette.
We'll keep working through with Lynette.
Okay,
Thank you.
thank you.
All right. I'm not seeing any more questions, so I think we can
Pamela, you did
give
have
it.
your hand up. I know you
Oh,
asked the question and then it went up again. Did you have another question?
Oh, I was just curious about Tina's comment about poisoning of the Nicorette gum. So any information about that, that'd be helpful too. Thank you.
okay. Yeah, for sure.
I know something else, Shay, that Dina had mentioned that she's interested in finding out, and we don't know where to find out this information, but Cigarettes that aren't like commercial cigarettes, because dosing guidelines for Nicorette and patches are specific for if you smoke this number of cigarettes from this
Yeah.
brand, this is what your dosing is. And she was saying one of the things they're running into is there's no data on what off-brand cigarettes might contain in terms of nicotine, so it's a little harder for dosing for that.
Do you mean off-brand or do you mean like hand-rolled cigarettes?
It could be either way. It could be hand rolled. Cigarettes bought
Mm-hmm.
at the Nation. It could be anything, but like not, I think like if you're buying cigarettes from Imperial Tobacco, you know how much nicotine's in
Yes.
those cigarettes. Yeah. But anything that's not, I guess commercial, meaning like corporate tobacco, is a little tougher.
Yeah. I see what you're saying. I'm not sure if I'm aware of anything specific. I will do some digging, but what I will say is that when you're doing kind of like dosing for nicotine replacement products, and this can be for like the patch or lozenges or sprays, especially the longer acting ones, like the medications or the patch, it is important to discuss with a pharmacist kind of
Mhm.
where you're at. And then it's equally important if you're having any issues to go back and rediscuss with the pharmacist because they are the ones who have the real expertise in kind of like dose adjustments. I see your hand, Tina.
Yeah, I just wanted to speak to the overdose thing.
Hmm.
So with the gum, a lot of times when you're chewing gum, you're just kind of chewing it. But with the nicotine gum, you can only chew it so many chews, and I don't even know if you're allowed to hold it in your mouth. But when you're going through that addiction withdrawal, trying to keep your hands and mouth busy. Like that's how my husband ended up overdosing on the gum because he was like chewing it like gum after a
Totally.
while. And then basically replacing that for his hand to mouth addiction. So he was kind of eating too many gums and then chewing them too much. And yeah, it just poisoned his blood. He got really, really sick.
Mhm.
So
Hmm.
yeah, there is some caution out there about the gum in particular, because yeah, you do tend to just chew gum if it's in your mouth.
Hmm. Totally. And I think for those short, like there are a few they're like shorter acting products. So the gum is an example of that. You're supposed to take it in order to address specific cravings. Same with like lozenges, which are like the mouth drops, or like there's a kind of like a spray, like a Listerine spray almost that you can use as well. But with those short acting products, you really do have to be careful. And maybe there needs to be more education from pharmacists. About that kind of like upper limit. So if this is something that we are hearing, and thank you for bringing it up, we can definitely work on developing something to make sure that people are more aware of this. So I think, are there any more questions?
Oh, it's just Pamela again. I was hoping that one of the team members could put it in the calendars. So I'm Pamela, I'm the health manager for Huckshaw, Douglas First Nation, and we're the host for the Statlium Gathering in May. I believe it
Okay.
starts the week of May the 10th. So all
Okay.
that week, it'd be great to have one of your team members come up. Yeah, it's going to be a full week for us. So the more people I can get there for us, the better. So just
Awesome.
putting it out
Definitely.
there. So mark your calendars, please. Thank you.
Amazing. Thank you. And definitely, I can send you an email. I imagine I can get your email through Kim, or if you want to send me and Jack's emails through our respective emails, we can definitely organize that.
Yep.
Thank you so much.
Thank you.
Yeah, and the contact information, we'll make sure we include that when we, as sort of accompanying when we upload the webinar or when we send out the copy of the presentation. But also for anyone on the call who you kind of think like tomorrow, oh darn, I forgot to write down Jax's contact information or whatever, you are more than welcome to reach out to us. Just throwing our team email in the chat, fnhda@fnha.ca. You can always sort of send something in there and be like, hey, I was on the webinar, can't remember can't remember the name of the presenter, but please can I have their email? We'd be more than happy to help to connect you guys that way too. So
Awesome. Thank you for doing that, Kim.
all right, well, I don't see any more questions either or any hands up. In which case, yeah, I think we had booked this for an hour. So it looks like everyone gets 10 minutes back. So that's always a good thing. Little time for a little stretch. Thank you all for being here. Thank you very much to Jax and Shay for coming and sharing your knowledge and resources with everybody. And welcome to 2026, everybody. Looking forward to connecting with all of you again really soon.
All right. Thank you
Thank
so much
you.
for organizing this and having me. Thank you.
Anytime. Bye, everyone.
Bye.